Hi, yes, it's Paul here from Tangmere Dental Care near Chichester, doing a series of tests. We're finally on to some with real equipment. I've done some with the scalers and with the turbine to establish baselines for how long it takes for aerosol from actual dental equipment to settle without any mitigating features. There'll be links to videos up here for other ones. Baseline tests aren't particularly exciting. I'm sorry, I can't really sort of dress that up, but they're not. So I'll try and do timestamps down at the bottom of the video, so maybe you can skip forwards to the results. I do appreciate people watching. Obviously this is my own risk assessments, and I suggest that other dentists start doing the same thing and maybe start sort of sharing things so that we can have a consensus of opinion in terms of how long fallow time between patients needs to be. But anyway, this is a key one today for me, because we've got the AirFlow system, which does Guided Biofilm Therapy, GBT, which is just fabulous for gum treatment and really needs to be brought back online. It does generate an awful lot of aerosol though, so I'm expecting this to take quite a long time for the aerosol to settle if the turbine is anything to go by. But of course this is going to be a test without any mitigation, no open window, no air purifiers, no air circulation system, so it's probably going to be quite a while. But anyway, I'll nip next door into surgery 2, which is where the GBT machine is, and we'll do that baseline test. Alright, so off we go. So let's see what actually happens here in terms of aerosol without any mitigation. So I've got my PPE on because obviously I haven't even got the surgery suction going here, and we've got a lot of biofilm. So just checking the particle meters, readings are low, and so off we go. Oh, well, okay. It's going to be messy. Okay, let's stop the AGP there. All of our readings are maxed out. Let's start the timer. And let's see how long this takes for the aerosol to disappear with the GBT machine. So rather like the turbine, in fact worse than the turbine, this maxed out the meter. And obviously this validates in a way that the Pison and the Cavitron actually aren't generating a lot of aerosol that is measurable, and therefore maybe a lower risk factor than other things. So yeah, I mean, you know, obviously we might be able to start bringing those back. I'm going to actually ask you guys, would you be happy, based on looking at the previous video with the Cavitron and Pison, would you be happy to work with just a clean down and really minimal fallow time? I'm going to simulate a little bit of movement, as I've done before, just because the aerosol might be in dead zones around the surgery. Well, we're going over 10 minutes now on the timer, and particle levels are still fairly high, so batteries of cameras allowing, I'm just going to let this run. If necessary there might be a little pause, but I'll keep the particulate meter running and I'll swap out the batteries. Okay, so we've been running a little while now. I've just moved my main camera around to the back here because my little GoPro here is going to die in a second. So I'm just going to leave the Sony running here, and we'll switch out the battery in the GoPro. Okay, so the GoPro's back, so we should be able to just let this keep going. Just getting myself ready there, and yeah, obviously I don't know when the phone fell off, but the timer's still going. Oh, right guys, well obviously this thing actually did keep going for a little time. The phone fell off yet again. As we can see, I hope you can see there, we've still got really high particle level readings, and the phone is still going even though it hit the floor, and the time is, you know, approaching the 45 minutes which it took for the turbine aerosol to drop down to normal levels. And here I think we can sort of see that the actual PM10 levels are sort of, they've taken ages to come down to into the low 40s. So I mean, on this basis, we just can't afford. I don't think people will be able to afford to pay double for their hygiene appointments. I don't think hygienists are going to be able to take a sort of over a 50% pay cut, because obviously there are other surgery running costs. And in that respect, this is just not viable to actually be able to use a GBT machine. Obviously, this is without any mitigation. So obviously, I'll be putting mitigation in and seeing that maybe that might do something. So obviously, please comment, and anyone that actually knows a little bit more than I do, an expert on aerosols, or obviously that has got better equipment than me, please put a comment down below. It does seem very interesting though about the Pison and the Cavitron. So that's I'd like comments on that in particular. So obviously, until the next one, thank you very much for watching. Please subscribe, and I'll look forward to those comments. Thank you. See you later. Bye.